Hello out there, this is Rob of Dialogue Health. During these challenging times with ever-changing information and policies, facilities need ways to quickly, reliably, and successfully reach their patients. If you want to get a message out fast, to a significant number of people, and with a high degree of confidence that your audience will receive and read it, send that message as a text. To help you navigate this transitionary period, you'll want to download our free ebook that covers 10 ways to use texting to improve patient engagement. Let's look at 5 of these best practices for using text messaging for your patient communication. Number 1, mass text alerts. Use these messages for announcing revised hours of operation, changes to safety protocols, and much more. Number 2, automated or direct texts. There's no better way to reschedule lost appointments, fill open slots in your schedule, confirm appointments, and send reminders to reduce no-shows. Number 3, support for telehealth. If your facility is leveraging telehealth, use texting to help patients schedule a telehealth visit, send direct hyperlinks to initiate consultations, and provide reminders about appointments. Number 4, safety procedures. Text messages are a great way to explain to patients the safety directions they are expected to follow for their appointments. This may include changes to check-in and discharge procedures, wearing of personal protective equipment, and revised waiting room policies. And 5, revenue cycle management. Send well-worded and polite texts reminding patients of their payment responsibility and the ways they can pay for their care. Include a link in the text to an online bill pay website if you offer such a payment mechanism. To learn more about these 5 best practices and the 5 we didn't cover in this video, download our ebook via the short link on your screen, the link in the description of this video, or by visiting dialoguehealth.com.